Hi, this is Dr. Hannah Bailey-Thomas from Haven Health in Felixstowe, and I'm going to be running you through the pathology results filing protocol from SPC from March 2018. First section of this will be just introducing you to the inbox, what things look like, what they mean, and how to approach this, and then we'll get into how to deal with normal and abnormal results of different types. So first of all, going into the inbox itself, if you see down here at the bottom of the screen, this is the area of pathology. This is results that are allocated to you, which may not be as relevant as this box, which is all results ready to file. Now, I'm not going to go into that box at the moment because I've got test patients here, and in this box has real patients, so that will break confidentiality. But what you would normally do is go into this main inbox and start looking at what's in there, and it will look the same as this, just more different people on this bit, as these have all been allocated to me. So when you open this box, this is what you find. So there's these tabs up here. I don't tend to use these because you can also do all the functions by right clicking on a result. So up at the top here you have different options. You have reports ready to file, reports with no patient, so these are reports that haven't been allocated to a particular patient, and they may actually be patients which aren't from your surgery. Reports with no recipient, so these are reports that haven't been allocated to anybody to deal with, and you will need to go into that and allocate them, potentially, depending on how your system works in your own surgery, and you may need to ask somebody about that. And then all unfiled reports is just a general inbox. So we're in reports ready to file, but you may need to go in this one first. But we've got these reports, they've been allocated to me. At this point it doesn't really matter who they've been allocated to be honest, because you can go in to the main inbox and take out the ones that you can deal with. So we're just going to approach it like that. So you've got an inbox full of stuff. So important here is colours. So black results are results which are somewhat abnormal but may be able to be dealt with by yourselves. Red results are abnormal and will usually need to be dealt with by a doctor, but we'll get into that depending. And then there are blue results which are normal. So they haven't actually given us any blue results, but I'll go through with you what you will do with them. What we've got down here is the day that the results came in, the date they arrived, the patient's name. Obviously it's all the same test patient, but these will be different names. The recipient, who's me, what type of test it was, and these flags. So that flag there says it's been automatically matched to a staff member, which is me. This says that it's been matched to a patient, but as you can see, this little envelope says it's not been viewed yet. So this is the most important thing. So all these envelopes here means that nobody's looked at it yet. So I've looked at this one at some point because the little envelope has gone away. So basically you can tell that the results that haven't been looked at by anybody yet by the little envelopes. So that's what the inbox, and you can sort these out by the different things. So if you click on one of these headers, it will sort them in that order. So then I've sorted all, which is very useful actually, sorted all the different full blood counts, all the different HIV tests, all the different specimens, U's and E's, and they all come up in their groups, which is quite useful if you want to go through and just use the protocol and just deal with a certain type of test which you know you can deal with. And that's how I would approach it, is just start with a test that you know you can deal with and you feel confident dealing with, and then work from there. You can also sort by patient. It's not going to work in this case because they're all the same patient, but that's quite useful if you want to make sure that you've dealt with all the tests from that patient, or that you want to forward them to a particular doctor. So if you were looking at a test and you wanted to make sure a particular clinician saw that test result, for instance it was very abnormal, or you didn't know what to do with it, you right click on the result, and that gives you various options. So you can either view the report, so what you'll need here is reassign recipient, because that sends it into a different person's inbox. So you press reassign recipient. We'll drill on that because different doctors and different practitioners here. So at the moment you're just reassigning that highlighted test here that you can see. You can also click to assign the rest of the tests with from the same patient. Now you've got to be careful with that because you end up assigning 26 tests to one person. You might want to do that, but most of the time you don't, and sometimes it does automatically click that box, and I've had problems myself with sending things forward. So you would basically just click on the clinician that you wanted to send that result to and press assign, and it will still appear in your box until you reset the system, but it would also appear in their box and be flagged up to them to look at as well. So I think that's the main things about the inbox itself. In the protocol it says, the aim of this protocol is to streamline the amount of patient information coming to GPs. And if you're unsure about any result, please pass to a clinician. And any results that you feel may be urgent, please alert duty doctor immediately. The term clinician in this protocol refers to a person responsible for actioning and filing abnormal results. Usually a GP, but some places have nurse practitioners or other clinicians who are able to do this.